we've seen a trend of EMS starting to bypass the primary stroke centers and taking patients to comprehensive stroke centers, thinking that they're going to have a more comprehensive care, and why waste time at the primary stroke centers. Now, fortunately, when the American Heart has been very clear on this, if the comprehensive stroke center is within 15 minutes of driving, then it makes more sense. However, if they are much further along, then it's better to take the patients to their primary stroke center, because remember, that stroke is happening in real time. And you want to get to the patient as quickly as possible to give them the thrombolytics as quickly as possible, and then make decisions from that point on. So if you have a patient who is 30 minutes to an hour away from a comprehensive stroke center site by drive, and we decide, and EMC decides to bypass the primary stroke center and go straight to the comprehensive stroke center, now what happens is they don't get the treatment that's life-saving in good time. So what we've actually seen now happen from time to time, we see a patient that's maybe literally right next door to a primary stroke center, and they're taken by the ambulance to a comprehensive stroke center that's an hour away. And now, it's really gone to the extremes from time to time, where we see patients then end up in a comprehensive stroke center when a stroke is completing, because so much time has lapsed. They didn't get the opportunity to get the clotbuster, and now whatever that has been done now dictates what's going to happen for the rest of your life. Now you've sustained a major deficit. So it's a kind of a fine balance. We really want to make sure that whatever happens to the legislation doesn't prohibit the right care for our patients and the right quick care when they really need to get that clotbuster medication as quickly as possible, to delay that treatment for a prolonged period of time until they can get somewhere else, at which time sometimes the strokes are completed. So I think there really needs to be better guidelines, and there really needs to be more education for EMS to be able to screen out who can directly go to their primary stroke center first and who can directly go to the comprehensive stroke center. And I think it's the task of all the hospitals, inclusive of all the primary stroke centers and comprehensive stroke centers, to do the education for EMS as to how they can screen patients and select which patient is to go to where. What we would do as telespecialists is partner with hospitals with primary stroke center certification, partner with the hospitals in how they can cooperate and collaborate with the EMS, and to, number one, show their colleagues with EMS that there is a good program here that's going to take care of the patients very quickly. Our response times are phenomenal. We get on the screen immediately. Our dural needle times are amazing. And we can have the patients be treated that need to get the treatments in a timely fashion. And that collaboration with EMS is going to be very, very important to allow EMS to understand that there's a lot of value for bringing these patients to their hospitals or primary stroke centers.